As of today, Cambridge-based Moderna's COVID vaccine has joined Pfizer's in having official full FDA approval after more than a year of emergency authorization. And new data out from the CDC today is proving what public health officials have been shouting from the rooftops for months. Getting vaccinated and boosted is extremely effective at protecting against the worst consequences of COVID. People in the U.S. who have not gotten a booster shot are 6 times more likely to die from COVID than those who have. And as for those who haven't gotten a single vaccine dose, they're more than 75 times more likely to die from COVID than someone who's been fully vaxxed and boosted. They're facts that make vaccine mandates feel like common sense to a lot of people, including Boston Mayor Michelle Wu, whose city employee mandate is being challenged in court. Last week, a judge temporarily halted the requirement after Boston police and firefighter unions sued to overturn it. And as for her proof of vaccine requirement for public indoor spaces, that's getting pushed back too. The Massachusetts Restaurant Association sent a letter, this is according to the Boston Herald, saying, quote, some Boston restaurants are losing as much as $15,000 a week because of the policy, an issue Mayor Wu addressed in part when she spoke yesterday.
This is such a tough time for our small businesses, so I really want to encourage everyone to go out there, shop local. We're doing everything we can on our end to keep the workforce safe, keep our customers and the public safe. We're also putting out grants that should open up in the next week or so, so that small businesses that have been hit hard can apply for some relief.
I'm joined now by one of the people helping Mayor Wu through it all, Executive Director of the Boston Public Health Commission and the head of Mayor Wu's COVID-19 Advisory Committee, Dr. Bisola Ojikutu. Doctor, it's very good to see you again. Thanks so much for your time.
Hi, thanks for having me.
In the last couple of weeks, Mayor Wu and the head of the Restaurant Association joined us on our radio show. I want to play for you first what Mayor Wu said 3 or 4 days after the mandate went into effect for restaurants, gyms, etc. And about a week later, what Bob Luz, head of the Restaurant Association, had to say. Here they are.
It's been very, very smooth. That implementation has been pretty smooth all across the city.
It's having an effect on business, and it's having an effect on different parts of it. I mean, we have large events that are withdrawing from the city. We have trade shows rescheduling. We have regional bus tour operators now saying they're going to skip Boston and just go to Newport, New Hampshire, Maine. And, you know, we've had problems at the front door.
Doctor, it seems to me they can't both be right. Who is?
Well, I think that it's just different perspectives. I realize that what's happening now in terms of our businesses is just tough. I mean, the pandemic has been tough on businesses and entertainment. And certainly we're in the middle of a surge. We're still, you know, though we're cautiously optimistic that our numbers are going in the right direction, the fact that we're in the middle of this surge certainly may dissuade people from going out and eating in restaurants or engaging in entertainment activities. So certainly that may be a factor, not just the issue of the indoor proof of vaccination requirement. But the other thing that is a more positive note is that we have seen, you know, fewer complaints, fewer issues in relationship to the indoor vaccine proof of vaccination requirement than maybe we anticipated. And you know, on Mayor Wu's COVID-19 Advisory Committee, we have a number of business leaders who actually welcome the city taking a leadership role in this regard. So I have to say that it's been a positive step in the right direction, and definitely a positive initiative.
So to be clear, when Bob Luz says that some restaurants are losing $15,000 a week, it is conceivable that that's true, but I think you're suggesting, sadly, that may be the cost of dealing with this pandemic now so that we're rid of it sooner rather than later. Is that a fair characterization of where you are?
I think so. I mean, I think that some of this is a bit of a trade-off in a sense. I think that, you know, we were at the point in terms of our vaccination citywide where if you compare the number of people who are, you know, sort of getting their first vaccine dose week to week, we were rather stagnant. We were sort of flat in terms of uptake. And it wasn't until, you know, we instituted this mandate and other things happened. We really ramped up access. We really put forth a strong effort in terms of media campaign to get people vaccinated. Sure. And it's just so critically important to ending the surge and for protection as we move forward with COVID and living with COVID-19 that we had to do something.
Let me ask you what I asked Mayor Wu when she was on the radio with us a couple of weeks ago, roughly. This will make the Restaurant Association even less happy. If we're going to have a vaccine mandate in Boston to go into restaurants, And we know that the booster not only limits the spread, but also makes the boosted person safer. Why is fully vaccinated as of February 15th not including a booster, say come, I don't know, March 1st or March 15th, assuming the mandate's still there?
So you're absolutely right. Boosters are incredibly important in terms of protecting people from severe illness and hospitalization, decreasing emergency department and urgent care utilization, as well as decreasing symptomatic and asymptomatic illness. But you can't get boosted until you get vaccinated. So you have to get your primary series. So this is a first step. I think our goal as a city is to remain nimble, to follow our data, and to do what we think is best in terms of taking those first steps to getting us where we want to go. As a city, we're probably around 48% boosted, and I think we have a lot more work to do, but that work is on the horizon. It's definitely something that we're working on every single day.
So at some point, being boosted may be added to the definition of fully vaccinated. That's what you're saying, correct?
Well, I think the terminology is already changing. So fully vaccinated does incorporate just the primary series, but what I think is happening nationally is changing the sort of the phrasing to up to date.
No, I want to be clear. No, I'm sorry. Maybe I didn't understand. Is there a point at which, if the vaccine mandate stays in place to get into a restaurant, for example, that it won't just be 2 shots as of February 15th? At some later date, it might be 2 shots plus a booster. That's what I'm asking. I'm sorry.
Well, no, I actually understand your point.
Okay.
I think that we have to look at all options on the table. We need to protect our populations from, as I said, severe illness and hospitalization. So as we look at our metrics, we will remain nimble and look at all options in this ever-evolving pandemic.
And the mayor's also said, I think it was in mid-January, that there's a small business relief fund which is going to be giving grants, I think up to 10, maximum of 10 grand per business, to help 300, give or take a few numbers of small businesses get through this difficult period. When is that happening?
So I have to say I don't have the answer to that. I apologize. I'd have to get that to you after this.
Okay. Let's move to the mandate for city employees. I know you can't talk about the ongoing litigation with the public employees. I can, by the way, even though you can't. And the fact that the Patrolmen's Union is saying no and is requiring something be given them, and that 2 free mental health days is not enough is just unbelievable to me. But let's go beyond that. It's working, is it not? The reality is the mandate for employees is causing the numbers of vaccinated city employees to skyrocket. Is that not correct?
That is correct. I mean, most city employees are now vaccinated. I believe that the last number was 94, 95%. And we anticipated this. So mandates normalize vaccination. They make it routine, standard practice. And we know that it works. School-based vaccination works. School-based vaccination mandates work. Vaccination amongst workers in healthcare settings, that also works. So it's an important strategy to use when you really need to get to the point where we get, most of the population vaccinated.
Do you not worry? There was a story in the Globe the other day about the Boston Teachers Union suggesting that for those who are unvaccinated in their numbers, and the Globe mentioned that somewhere in the neighborhood of 75% of the kids in the Boston public school system are either Black or Latino. Only 42% of their teachers are Black or Latino. The suggestion from the BTU was that the mandate will have a disproportionately negative effect on teachers of color. One, do you find that to be an accurate assessment? And 2, if it is, does it not worry you?
So I think that my concern is to get everybody vaccinated and boosted so that we can address, or that will address many of the disparities, the very stark disparities that we've seen throughout the COVID-19 pandemic. A central focus of public health is the pursuit of health equity, right?
Sure.
So if you take an intervention like vaccination and you apply it uniformly and universally, and those positive effects that we just talked about in terms of decreasing severe hospitalization, decreasing severe illness, decreasing emergency department and urgent care utilization, you are even closer to achieving the goal of eliminating inequity. So all of the people who are in the racial and ethnic groups who have been suffering from inequity throughout this pandemic, we can close that gap and eliminate some of those disparities if we apply vaccination universally.
Can we return just for a second to the small businesses, well, all businesses, but small businesses in particular that I know Mayor Wu and you are particularly concerned about? there's no end date. It seems to me that if I were in their position and was troubled by this mandate, whether it's as a concept or not, or purely because it's hurting my bottom line, if I knew either what the end date was or what the end date was tied to, a certain positivity rate, a certain vaccination rate, it seems to me it'd be more tolerable to get through. Is that going to be made public at some point? Do you know what the point is once reached would cause the vaccination mandate to enter a restaurant or a gym or a performance venue would disappear? Do you know that?
So we're actually looking at our metrics every single day to determine when we think that it would be appropriate for us to, adjust policy making or adjust this particular policy accordingly. The reality is that across the country, in those jurisdictions that have implemented similar indoor vaccine, proof of vaccine requirements, they are also looking at their metrics on a regular basis. So we're going to follow our positivity rate. We're going to follow our hospitalizations. All of this is trending in the right direction, and we'll make changes accordingly. I don't think that this is meant to be something that's indefinite.
No, I understand, but let me just one last question, if I may. Is it possible that you will announce before the fact that when we reach, and I'm making up a number, 10% positivity or 83% fully vaccinated, that's the trigger which would end the mandates? Is it possible that could be announced?
Absolutely. That's the point of looking at our data on a regular basis and determining where we think it might be appropriate and safe for people to, engage in activities without having this indoor proof of vaccine requirement. And so we're looking at our vaccination rate as a city. We're 70.5% fully vaccinated, 48% boosted. Our hospitalizations are trending downward, but they're still high. Our overall community positivity rate is 17%. That's down from a high over 32%. So as we follow those, we will come to what we're calling a threshold. And at that point, we can shift in terms of our policies.
Dr. Ojikutu, thank you so much for your work and your time. I really appreciate it.
Thank you for having me.